patellar tap and fluid sweep test. So the indication for patellar tap is for massive effusion of the knee joint. So this is done when you see a gross swelling indicating massive effusion. So what do we do? Number one, patellar tap. So there's an indication, okay? You don't have to necessarily just do it for the sake of doing it. It is an indication, meaning if you see a gross swelling, okay, which indicates massive effusion, you do patellar tap. So how do you do? The first step, look at the superior border of the patella. So this is the patella, the superior border of the patella, approximately 4 finger breadth length. So place your 4 fingers. So from here, use the dominant hand, okay, from the superior border of the patella, 4 fingers, okay, and place your non-dominant hand here and push. Milk everything. So this is where the suprapatellar pouch is. Okay, so we are emptying the suprapatellar pouch, the content of the suprapatellar pouch into the joint space. So one is this is done, you do not lift the hand off. You just use your finger and you push the patella down. So the test says patellar tap, but you do not actually tap. You actually push. So the test is positive if you can feel yourself pushing the patella down and if it hits the femur. So an analogy would be like the patella is like a floating island and you're pushing it down to the seabed. Okay, so that indicates that the patella is, the patellar tap test is positive. So be careful, at times you may get deluded because when you push, remember that the patella is also mobile, right? So do not get confused. You have to feel that you're pushing the patella downwards and not sideways. The patella is either ways movable sideways. So the slight mobility of the patella should not be confused with an actual positive patellar tap. Sorry, the next test is fluid sweep. So what is the indication for fluid sweep? So when there's minimal effusion. So how do we know if there's minimal effusion? So you wouldn't get a gross swelling here. What you have to do is you have to inspect for the parapatellar gutter. So look at this depression here. So you can see a depression here. So that is the medial parapatellar gutter. The depression here is the medial parapatellar gutter. So in a small effusion, this gutter will be obliterated. So you would not find a depression. Okay, you will find some fullness there. Basically, just know that if you can't see the depression, then that indicates that the parapatellar gutter is obliterated. So if this is in the findings, then the same thing, right? So you just push down, okay? Then you sweep the fluid medial to lateral, okay? So when you do this, you will notice that the parapatellar gutter re-emerges. So the initially obliterated parapatellar gutter, the medial parapatellar gutter, will resurface the moment you shift the fluid to the lateral side. So just shift, okay, just shift. And when you push the patella laterally, you may notice a ripple or a bulge. So that will indicate that the fluid sweep test is positive.